Mutagani from Channel 1 Global TV with the most novel medical information. Today we have another star scientist special guest, Dr. Alex Bekker. Dr. Alex Bekker is a physician, author, and academic. He is a professor and chair at the Department of Anesthesiology, Rutgers New Jersey Medical School. He is also professor at the Department of Physiology, Pharmacology, and Neuroscience. He serves as the Chief of Anesthesiology Services at the University Hospital in New York. Dr. Bekker's research interests include clinical pharmacology, perioperative medicine, neurosciences, and medicinal applications of cannabis. His initial work was focused on techniques of separating carbon isotopes for military and medical applications. During his work at Allied, he advanced a new process of converting heavy hydrocarbons to fuels using supercritical fluids, leading to 6 US patents. Later, his research has been in the area of clinical pharmacology of sedatives and analgesics, understanding the effects of perioperative stress and anesthetics on cognition in the elderly and brain protection. He is an author of 120 peer-reviewed publications, as well as more than 200 scientific abstracts and meetings. In addition to publication in academic journals, his early work in industry led to the award of 6 US patents. Dr. Bekker's work on expanding uses of dexmedetomidine, a new agent introduced in 1999 for sedation of critically ill patients, led to FDA approval of this drug for procedural sedation. Dr. Bekker, I am so honored and privileged for this interview. Thank you so much for accepting our invitation and your time.
Okay, we good? Can I start?
Dr. Bekker, I am so honored and privileged for accepting our invitation. Thank you so much for your time.
Negar, thank you so much for the invitation. I'm honored and pleased to discuss adverse effect of cannabis with your audience. A small physician prescribed cannabis to treat various conditions. It's important to realize that cannabis, like any other medication, there's some adverse effect associated with this treatment. But there's so much misinformation and strange claims that I thought it would be a good idea to put everything together. In the next 20 minutes, I will try to kind of differentiate facts and fiction. Some physician claims, next slide, please. Some physician claims everything. Next slide, please. Right. And they are too extreme. Many years ago, Confucius said that to go beyond is as wrong as to fall short. So on one side, you have physicians who claim that cannabis can treat anything. On another side, you have this silly claim by people who are against cannabis. So today's talk, we will focus on what's real and what's not real. Next slide, please. In New Jersey, where I'm from, cannabis has been approved for medical as a medical therapy in 2011, and this slide lists conditions for what this treatment was approved. And in 2018, I was chairing advisory panel to New Jersey Department of Health, and we approved additional condition. Next slide, please. Right. So as of now, We have like 26 conditions in New Jersey, and it's more or less across the country. Approximately 20, between 20 and 30 condition treated cannabis can be used to treat this condition across this country. Next slide, please. And this slide suggests, like again, it's in New Jersey. 5 most common conditions which treated by cannabis include chronic pain, intractable spasticity, anxiety, PTSD, and severe chronic pain associated with HIV and AIDS. Before we go to and consider adverse condition associated with adverse effect associated with cannabis, I would like to set up a context. Next slide, please. These numbers are taken from FDA website. Everything is should be understood in comparison to some type of baseline. Whatever condition, whatever adverse effect we will discuss in relation to cannabis, I want you to look through this number. In 2018, there was 196 8 or 7 deaths associated with FDA-approved drugs, and more than a million serious side effects. When I talk about serious side effect, I mean effects like hospitalization, permanent disability. So most of FDA-approved drugs associated with adverse effect, and as you see by this number, it's not a trivial number. So when we talk about adverse effect associated with cannabis, it should be clear that any drugs, FDA-approved drugs, can lead to serious complication. And whatever my next few slides, when we'll discuss adverse effects, should be understood in this context. Nothing is benign, nothing comes from nothing. So next slide, please. This slide shows that in states where medical cannabis been introduced, prescription of other drugs, let's say drugs for pain, mostly opioid, anxiety, and things like this. And you see on this slide seizures and sleep disorder, everything was decreased. And author calculated that just by decreasing amount of prescribed drugs, they are saving about 165 million. And if you it's a Medicare Part D, then total saving, if every state will introduce this law, it would be about $500 million savings. More than anything, reduction in opioid prescription led, which is not calculated here, but definitely would lead to reduce amount or reduce opioid-related side effects. Next slide, please. This is very similar study, and it shows how medical marijuana laws affected prescription in Medicaid enrollees. Again, about somewhere around 20% reduction in prescription drug, which lead not just saving, but improve outcome, simply because a lot of these drugs, like opioids and benzodiazepine and some drug from depression, associated with side effect. By reducing amount of prescription, we reduce amount of side effects. Next slide, please. This is an interesting slide, which I would like, give me a second. Somehow you have different slides than mine. I see, okay, it's changing. So this slide shows active to lethal dose ratio independence potential of various psychoactive drugs. Like worse would be heroin, it's in red. It shows that you need very small amount to which can lead to lethal injection. Marijuana is on the other side. It's almost impossible to overdose. It's almost impossible to overdose on cannabis. So again, in this upper right corner, it's much more. It's a dangerous drug, and here we'll have safer drug. So marijuana, in relation to almost everything else, it's a very safe drug, very few side effects, but we still need to be aware what's the side effects. Next slide, please. Next slide, please. Okay, in a short-term adverse effect of cannabis, well understood. Its inability to concentrate, dizziness, dry mouth, tachycardia, arrhythmia, can be psychosis, and can be paranoia. Some admission to emergency room department associated with paranoia and psychosis. Usually it's a new user of cannabis, and but we should be aware that the side effect exists. It's a short term. More important, and we will go through right now. Next slide, please. More important one, next slide, yeah. It's long-term side effect, and this is what most people worry about. If you start treating, like medically treated cannabis, what can happen? What patients should expect? So this is most commonly mentioned side effect. It's a psychiatric effect, dependence, withdrawal, insomnia, cognitive development. Usually it's associated with adolescent, cannabinoid hyperemesis syndrome, and orthostatic hypertension. And with dependence and psychiatric effects, the next few slides, we will review what it actually means. Next slide, please. This slide shows. Well, one second. It's not now. I'm giving lecture. Yeah, I'm so sorry for interruption. So this slide shows most commonly used treated condition when you use CBD and THC. When you use CBD, which is component of cannabis, it's people worry that marijuana can link to various cancer. Next slide, please. Next slide, please. Right. So this slide shows association. It's a meta-analysis of 19 epidemiological studies, and it shows that cannabis, despite claim of various physicians, does not lead to lung cancer. Next slide, please. How about head and neck cancer? Again, this is 9 case control studies, 13,000 patients. There's no association between head and neck cancer and use of cannabis. Next slide, please. How about bladder cancer? It was some actually, interestingly enough, use of cannabis was associated with 45% reduction in blood cancer. There's some research going on right now when people believe that that use of cannabis can reduce incidence of some cancer, and this is one of those examples. Next slide, please. However, there's one cancer which cannabis increase the risk, and this is testicular cancer. And its risk increase by about twice risk of testis cancer if you use cannabis. Next slide, please. Lots of people worry that use of cannabis can lead to road accident and things like this. Systematic review of and meta-analysis of somewhere like around 20 studies suggests that most dangerous drug from this point of view, it's alcohol. Increased relative risk about 20, and cannabis, again, risk is increased very slightly, risk of accident and things like this. Next slide, please. And this slide more or less emphasizes point. It came from Colorado. when they introduce cannabis in Colorado. Actually, you can see this graph, and this is 0. It's a year of legalization, and incident of traffic fatalities went down. And interestingly enough, interest of alcohol consumption went down, which is kind of expected. People want to use one of those. So it probably incident of traffic accident related to reduced consumption of alcohol, one way or another, results being positive. Next slide, please. Many years, I mean, this publication is from 1889. First time people tried to use cannabis. At that time, they used to call Indian hemp to treat dependence, chronic dependence, opioid dependence. And this idea is propagated by many researchers. They believe that by introducing and treating opioid addict with cannabis, we can reduce addiction. And there are lots of research going on there, and looks to me this is kind of it sounds very reasonable thing to do. Next slide, please. So this slide shows association between medical cannabis law and opioid prescription in Medicare Part D population. And you can see that in state where they introduce cannabis, opioid requirement, all opioid went down by about 15%, hydrocodone and morphine by about 20%. So it's significant reduction. Next slide, please. And very similar result, Bill, researcher found for Medicaid enrollees. Again, in states where cannabis, medical cannabis, been introduced, opioid prescribing rate went down by about 20%. Next slide, please. How about very popular ideas that that cannabis cannabis exposure increase risk of mental development, increased risk of poor development in adolescent, and shows that some studies topic is controversial. Some studies shows that it's definitely affect neurocognitive development. Some study don't agree. So I will show you a couple. Like this one study done by a group from University of Pennsylvania, and they compare effect of cannabis on executive function, memory, and so on. And actually, interestingly enough, executive function was improved with use of cannabis. It's a strange result, but this is 20,000 patient teenagers, and this is what they see. Executive function and memory being improved in adolescents which use cannabis. Next slide, please. So this is interesting study, came from South Florida, and they assess various domains in adult, and they show also acutely, obviously, it will affect your cognitive performance on 25 days after you stopping use of cannabis, your mental cognition comes back to normal. So there's no permanent effect. Next slide, please. And this is again in young adults, a very similar result. If you abstain from cannabis for more than 72 hours, cognitive deficit associated with cannabis are diminished. Next slide, please. And actually, in some cases, some researchers use cannabis to improve performance, especially in the elderly patient. And it's kind of, if you're anxious and you worry about your performance, so cannabis will relax you. So you don't have like in some cases, people try to use cannabis to improve cognitive performance. And this is one interesting study. Actually, it's in mice, not in human. Now they're trying in human, and this study shows that chronic low dose of THC improve cognitive performance in Alzheimer model of elderly mice. So right now there are actually clinical trial going on, which use of cannabis in Alzheimer patient. Next slide, please. Effect of human behavior, cannabis and human behavior, and this is definitely controversial area. If my advice would be, if you have a history of psychotic behavior, psychotic disorder, cannabis is probably not right medication for you. It can further deteriorate your psychotic hallucination and ideation. Next slide, please. On the other side, if you use CBD, which is again cannabidiol, which is part of cannabis, people try to use it to improve some symptom of psychotic behavior, and it can be used as antipsychotics. Next slide, please. Question is, is cannabis a getaway drug? Lots of people worry about it. Scientific approach will tell it's kind of, if somebody likes to use, if somebody likes to eat, I don't know, cake, most likely they will like to eat donuts and French fries and so on. Very similar situation here. If you use cannabis, it's quite possible that you eventually will start using it as a drug, not necessarily related to cannabis. This is your nature and you're more adventurous. So there's no study which demonstrate that cannabis leads to use of as a drug. Actually, this little study shows that most dangerous from this point of view, it would be nicotine actually. Nicotine, alcohol, cocaine, and cannabis are very stable. If it does increase use of other drug, it's not on the level of other substances. Next, I want to conclude it with one little story, like anecdote. About a couple of years ago, this paper on use of cannabis in opioid, use of cannabis in patients with non-cancer pain who take opioid was conducted in Australia, and they found and they claim that they didn't see any evidence of relationship between cannabis use and pain severity, or and they no evidence of cannabis use and reduced prescribed opioid. What they kind of essentially saying that cannabis didn't help. It kind of goes against from what I was talking before, but its study was published in Lancet. It's an important study. So I kind of review this study, and I wrote letter to the editor, kind of looking through their own number, and it shows that in 3 years from their data, that 83% felt that cannabis reduced their pain, reduced distress, improved sleep, and helps them to relax. Some of the study, because of stigma attached to cannabis, they report results which is not necessarily what they actually data show, because it's kind of correct things. Some physician believes that it's for many years it was described like this dangerous drug which leads to all kind of complication. So some researchers have certain inherent bias. But if you independently look at this data, it shows that in many situations, adverse effects of cannabis are minor, and benefit from using cannabis way outweigh minor adverse effects associated with cannabis. At this point, I will conclude and kind of summarize what the adverse effect we can expect. Cannabis addiction, about 8% of people who use cannabis get addicted. Possible effect on cognition, possibly psychiatric disorder, getaway drugs never materialize. It's a fiction. Cancer, there's no really incident, no except testicular cancer. There's no effect of cannabis on cancer. And poisoning, there are no death, and still right now there are no deaths associated with cannabis overdose. It should be very clear that adverse effects, if they're there, they're very minor. Thank you for your attention. Thank you.
Dr. Bekker, very impressive, beautiful talk. Thank you so much.
Thank you, Negar. Thank you for the invitation, and have a good day, guys. Thank you.
Thank you so much. Have a wonderful day.